Alright, this is my friend Kara. She will be playing as a Pakistani named Ezra, who's coming into the clinic to get her physical done. And I'm just teaching her about type 2 diabetes. Alright, here we go. Hi Ezra, my name is Kayla. I'll be your nurse today. I'm going to teach you about type 2 diabetes and kind of go do an overview about what the disease is, what the medications are, and just some things to help you out to kind of get to know what's happening. Alright? Type 2 diabetes is a disease where your body does not use insulin properly. It causes your blood sugar, which is also called glucose, levels to rise higher than normal. In other words, your body becomes resistant to this insulin. And in the beginning, your pancreas, which is located over here, makes extra insulin to make up for the extra sugar. But over time, it can't make enough insulin to keep your blood sugar at normal levels. When your blood sugar gets too low, it's also called hypoglycemia, you may experience symptoms such as shakiness, nervousness, anxiety, sweating, chills, clamminess, irritability, confusion, lightheadedness, dizziness, hunger, nausea, blurred vision, tingling or numbness in the lips or in the tongue, headaches, weakness, fatigue, anger, stubbornness, or lack of coordination. To fix these, you can check your blood sugar, then eat a simple sugar such as honey or orange juice. Wait 15 minutes and then check your blood sugar again to see if it's about the same, to see if it's at normal levels. If it's not at normal levels, repeat it again and call your physician. When your blood sugar gets too high though, it's called hyperglycemia. Some signs and symptoms of hyperglycemia is frequent urination, so when you have to go to the bathroom a lot, increased thirst, so you're really thirsty, blurred vision, and fatigue when you're really tired, and also headache. If this goes untreated, it can lead to ketoacidosis, which is also known as diabetic coma, and it can be life-threatening, so you don't want it to get that far. Some signs of ketoacidosis, which is the diabetic coma we were talking about, is a fruity smelling breath, nausea or vomiting, so if you're getting sick, shortness of breath, so you can't breathe really well, dry mouth, weakness, confusion, coma when you pass out, or abdominal pain, so if you feel some pain in your stomach. Uncontrolled diabetes can lead to things such as eye problems, where you can't see as well, a neuropathy, which is where you lose feeling in your limbs, in your legs and your arms, and your immune system becomes suppressed, so your wounds, like when you get a cut, can't heal as quickly, which can lead to infection and have you get sick more. Some diagnostic tests that you can take one of them is called the hemoglobin A1C test. This test is an indication of your average blood sugar over a course of 2 to 3 months. What it tests is it looks at your hemoglobin, which carries the oxygen in your blood. So when you breathe, it gets attached to the part of your red blood cells that carries the oxygen. And when your blood glucose is high, sugars will attach to this hemoglobin. And you can tell if your blood sugars have been high over the past 2 to 3 months, you'll see that there's more sugar attached to these hemoglobin. If you want your hemoglobin A1C test to be about 7% or lower, if it's higher than 7%, 2 to 3 separate occasions, it's an indication that you do have diabetes. Some risk factors for type 2 diabetes have been identified to include age, your sex, meaning that you're male or female, your obesity, low physical activity, smoking, diet, which would include low amount of fiber or high amounts of saturated fat, your ethnicity, family, or history of type 2 diabetes. If you have a family history of type 2 diabetes, it may be difficult to determine whether or not your diabetes is due to lifestyle factors, such as eating or exercising if you eat poorly or if you don't exercise enough, or if it's just genetic, if it's genetic susceptibility. It's most likely due to both, however, but it's been shown that you can either delay the process or prevent it by exercising and losing weight. So that's always good. Some medications that you may be able to take would be insulin. And what insulin is, it's a naturally occurring hormone in your body that is secreted by your pancreas, and many people with diabetes take insulin. But because they take insulin, but it's because that their body can't use it properly, so we give them more. Some side effects are feeling anxious, behavior change, so if you are normally happy, you kind of become a different person, similar to being drunk, so you act like you're drunk. Blurred vision, cold sweats, confusion, convulsions, which are you're having seizures, depression, so if you start to feel sad, difficulty thinking, dizziness or lightheadedness, drowsiness, excessive hunger, a fast heartbeat, irritability or abnormal behavior, nightmares, restless sleep, shakiness, slurred speech, tingling in the hands or feet or lips or tongue, or unconsciousness. If any of these side effects occur, notify your doctor immediately. Dosage of insulin depends on your blood sugar levels at the time. It varies either on a sliding scale, or some people get it as a long-term therapy. Another medication that you may take is the class of magnetides, which is a drug that stimulates beta cells, which release insulin. So in other words, it has your body produce more insulin. They're taken before each of the meals that you take, because these drugs stimulate the release of insulin. You have the possibility of becoming hypoglycemic, which is what we talked about when your blood sugar gets really low. An example of this drug would be Starlix, which may, if you receive an allergic reaction, such as hives, difficulty breathing, swelling in your face or lips, or in tongue and throat, call for emergency help immediately, first thing you do. Or you can call your doctor if you have seizures, which is when you're shaking and stuff, or jaundice, which is when you have your yellow skin or yellow eyes. So call your doctor if you have those. Other common side effects are runny nose, diarrhea, back pain, dizziness, or joint pain and stiffness. The usual dose for an adult for type 2 diabetes for Starlix is 120 milligrams orally, 3 times daily before meals. Or if your hemoglobin A1C, that diagnostic test that we were talking about, if it's close to its normal range, around 7%, you want to take about 60 milligrams 3 times before meals. Some nursing interventions and lifestyle changes for type 2 diabetes would be for nutritional change. You could eat meals that would keep your glucose at a steady level by eating more complex carbs instead of simple sugars. Simple sugars are, like I said before, like honey, candy, sweets. You want to eat more of a complex carb, which is more of your oats, oatmeal, leafy greens, so lettuce, vegetables, and you want to try to maintain a healthy weight and exercise daily. This will if you exercise daily, it'll help keep your weight down, and it'll help you with your glucose levels and just weight management. And so, thank you for coming in. Thank you.